Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my review videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. And happy Nurse Practitioner Week. You'll be seeing things all week long as we continue throughout our celebration and questions and different posts you'll see from me as well. But this is day 2 for MP Week, and also it is Veterans Day. So thank you to all of our veterans for all of your service. You are appreciated. Thank you, thank you, thank you. But be on the lookout for the up and coming things in honor of MP Week, Veterans Day, and more, okay? But let's get into our questions as we continue this series. As I told you on yesterday, I am just pulling questions and making questions per system so that we can hit all systems this week for MP Week, okay? All right, question number 1 for today. A 45-year-old female presents with complaints of fatigue, pallor, and shortness of breath on exertion. She has a history of heavy menstrual bleeding and recently experienced significant weight loss. Her hemoglobin is 9.2 and her ferritin level is low. You suspect iron deficiency anemia. What is the most appropriate treatment at this time? Is it A, to initiate oral iron supplementation and recommend dietary changes rich in iron? B, refer the patient for a blood transfusion immediately. C, start the patient on ESA. Or D, prescribe vitamin B12 supplements and evaluate for malabsorption. Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So, here the stem of the question states, what is the most appropriate treatment at this time? And y'all know I always tell y'all when it's asking about the treatment, you want to run it back and see if the diagnosis has been provided for you. And in the event that they have not provided you with the diagnosis in this question, you need to run it back a step further, review the assessment findings so that you're able to determine a diagnosis so you know how to treat this, right? So in this situation, it does let us know that we're suspecting iron deficiency anemia. Looking at the presentation, it is classic for iron deficiency anemia. The hemoglobin is low, so we know we're thinking it's some form of anemia. The fatigue, the pallor, the shortness of breath, associated with heavy menstrual bleeding, we know there is some form of anemia. Then the ferritin, being your iron stores, those levels are also low. So that's also signifying most likely this is iron deficiency anemia. So then you need to think of how do we treat IDA, right? Iron deficiency anemia. How do we treat it? So A is your best answer. You're going to go ahead and initiate that oral iron supplementation, right? We prescribe iron 325 3 times a day, right? And then you also want to encourage them, those lifestyle changes, encouraging them to eat things that are rich in iron. So again, A is your best answer. All right, question number 2. A 60-year-old male with a known history of hypothyroidism presents with complaints of weight gain, dry skin, fatigue, and cold intolerance. His most recent TSH level was elevated at 9.5, and his free T4 was low. He is currently on levothyroxine, but has not been adherent to his medication regimen. How should the nurse practitioner treat at this time? Is it A, increase the dose of levothyroxine and recheck thyroid levels in 6 weeks? B, start a combo therapy of levothyroxine and why do I always get tongue tied with this? Start a combination therapy with levothyroxine and liothyronine. Sheesh. C, discontinue the levothyroxine and begin a trial of our natural thyroid supplementation, or D, prescribe liothyronine alone, as levothyroxine is ineffective for this patient. Tell me what you got in the comments, y'all. All right, so stemming the question here, how should the nurse practitioner treat at this time? Again, we're talking treatment. Yes, the diagnosis has been provided. This patient has a known history of hypothyroidism. Lab values showing us they're still in an uncontrolled range because that TSH is elevated at 9.5. Y'all know what 10 is when we typically initiate Synthroid or your levothyroxine. T4 is low. This is classic presentation of hypothyroidism. But if he was adherent to the medication, it would be more level, is the expectation. But since he's not, okay, we're expecting to get lab values like this. So how do you manage this? Your best answer is is A. You want to increase that dose of levothyroxine to get him to the normalized range. Recheck him in 6 weeks, and you want to make sure that he is being adherent so that we can normalize it and get him control, and really educating him on the importance of compliance. There's no benefit right now to start a combination therapy of the levothyroxine and the liothyronine. There's no point of that. You don't want to discontinue levothyroxine because, hey, the reason why his labs are like this is because he's not taking the medicine as prescribed. And then you don't need to switch out the medicines right now. We're not saying that the levothyroxine is ineffective. The ineffectiveness is his compliance to the regimen, right? So let's increase the dose to get him to a normalized level and then recheck in 6 weeks. And if you need to adjust the levels at that time, you will. But A is your best answer. All right, lastly, question number 3. A 32-year-old female presents with dysuria, frequent urination, and lower abdominal discomfort. She denies fever, chills, or flank pain. She has no significant medical history, and her physical exam is otherwise unremarkable. UA reveals leukocytes, nitrites, and bacteria consistent with a UTI. The patient has normal renal function. What is the most appropriate management for this patient with an uncomplicated UTI? Is it A, to prescribe a 3-day course of nitrofurantoin? B, start a 7-day course of Cipro? C, order a renal ultrasound? Or D, begin immediate IV antibiotics? Take a moment and tell me what you got. All right, so here, still the question states, what is the most appropriate management for the patient with an uncomplicated UTI? Now listen, this is why I tell y'all about stems being so important. This stem tells us everything we need to know. You just need to know, how do you treat a uncomplicated UTI, right? But I say go back, look, and see what you need to pull from this, because you do want to identify, hey, are they allergic to anything? When we're thinking of treatment, you're thinking of all these so that you're not making these careless mistakes by eliminating things that we know to do, right? But no allergies noted, no significant medical history. Physical exam is unremarkable. This is a healthy 32-year-old female with an uncomplicated UTI. Your best answer is A. We prescribe a 3-day course of nitrofurantoin. I always tell you that's like our first line therapy, but also I tell you guys, uncomplicated versus complicated is one of the key components when treating and answering these questions on board. Uncomplicated are your patients with a standardized UTI presentation. They haven't been on antibiotics previously. Females, your complicated are those ones that are pregnant women, the elderly, males, people who have been on antibiotics and they're not getting any improvement. And so when you determine if they're uncomplicated versus complicated, then you don't change the medication. That doesn't determine the medication. It determines the duration of the medication, right? So with uncomplicated, you can treat from anywhere from 3 to 5 days on the antibiotic, whereas complicated, you can do anywhere from 7 to 10 days. So that's why A is your best answer. You want to prescribe that nitrofurantoin for a 3-day course, okay? All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And y'all know, y'all don't want to miss out on these upcoming giveaways and deals. So make sure you're subscribed. Make sure you click the bell so that you are being notified every time I post or the videos, so that you don't miss out. I have received messages, so you know that you don't want to miss the thing. So that is the greatest step to do to help you with that. And also, if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803 888-400-6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number one, at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently, my self-paced review course for family and adult Gero, designed for both exams, the ANCC as well as AANP, is also linked in the bio of this channel. If you need to do any practice questions to prepare, engage, and study your knowledge and your application, my QBank options are all available and linked in the bio of this channel. And as always, if you're looking to book any one-on-one sessions with me, I always say either call, text, or email, as I offer a variety of one-on-one session types. So I like to speak with you to gauge what you truly need to make sure that you're booking the appropriate session, okay? All right, you guys, as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Happy MP week. Bye, y'all.